Now, it's claimed that people living with HIV in England are twice as likely to experience depression or anxiety than those without the illness. A report by the National AIDS Trust suggests that mental health services aren't providing proper support due to a lack of training. Let's speak now to Calum Douglas, who's Policy and Campaigns Officer at the National AIDS Trust, and Eugene Lynch, who himself has been living with HIV for the past 8 years. Gents, it's great to have you both on the programme this morning. And Eugene, apologies, I'm just going to direct a couple of questions to Calum first, if you don't mind. Calum, good to have you on this morning. Just explain what the research has discovered here. People living with HIV twice as likely to experience depression or anxiety. Wouldn't you almost expect a diagnosis such as that to have led to, the opposite of an improvement in your mental health?
Yeah, exactly. We know that there is a strong relationship between HIV and poor mental health. People living with HIV are twice as likely to experience feelings of depression or anxiety than the general population, and more than 1 in 3 report being diagnosed with a mental health condition at some time. But despite this, the support that people living with HIV have access to is inconsistent. And while some people have access to specialist support, others rely on mainstream services known as IAPT, which are often great, but are not necessarily designed to meet the specific needs of people living with HIV. So this report set out to investigate how well these services are working for this population and how services can be improved.
I mean, Calum, it is not unexpected that people will focus on the fact that 2 in 5 respondents said that their mental health didn't change as a result of therapy. But the fact that 1 in 10 people said that their mental health actually worsened as a result of the therapy, I mean, that is staggering.
Yeah, I mean, there are some disappointing findings from this report. There's certainly a lot of room for improvement. We found that while IAPT can work for some people living with HIV, a lack of HIV training and understanding and poor integration with wider mental and physical health care services really are hampering its effectiveness. As you say, the figures are quite stark, and a quarter reported that their HIV status negatively affected the way they were treated, which is really disappointing in the UK today.
Eugene, apologies again for ignoring you for the past couple of minutes. I wonder if you can tell us just a little bit about your own story. I mean, you had your diagnosis 8 years ago, I believe. How did that affect you at the time?
Yeah, my diagnosis hit me quite hard. It was relatively unexpected, and it really affected my relationship and how I interacted with other people, my work, because I was trying to keep everything kind of hidden and inside. I had a lot of fear around people sort of finding out about my diagnosis because there's a lot of stigma associated with HIV, and self-stigma can be really, really impactful, and it certainly was in my case.
How exactly did it affect your life? As I understand it, it took you some time before you felt you were in a position where you could go and try and get some form of therapy. And even then, it wasn't necessarily all that you would hope for.
Yeah, I really tried to ignore the mental health symptoms that I was initially experiencing. So first I was in shock after the diagnosis. I think I was offered support at that point, but I didn't want to kind of know about it. I just wanted to take my pills, get physically better and sort of move on with my life. But that basically led to me suppressing all of my feelings that I had about living with HIV. And I didn't really tell anyone, apart from my partner, who got tested at the same time as me and tested negative. Fortunately, it stays negative to this day because the medication is so fantastic. But the impact that it had on my wider kind of just life in society meant that I was sort of having a lot of feelings of depression. I got very, very anxious. And over the period of about 5 years, my mental health deteriorated to such a point where I was having sort of daily panic attacks. I actually couldn't go to work anymore. I couldn't leave the house without having panic attacks. I was sort of worried about what people in general were thinking of me and whether I looked ill and stuff like that. And I don't think that it necessarily comes with a lot of other medical conditions.
Just one last question, though, to you, Eugene. In terms of the therapy that you received, what could have been different about it that would have improved your experience, that would have improved, well, ultimately your own mental health?
Well, I have to say, I was very lucky in many ways. My GP was fantastic. My GP initially diagnosed me with HIV. But when I was referred on to the initial mental health services, the focus was really on dealing with the biggest problem I had at the time, which was the panic attacks. So it was kind of dealing with the symptoms, but not really dealing with all of the underlying feelings I had about my physical health, my HIV, and I had wider problems with anxiety even before I was diagnosed. We didn't really touch any of that because it was really focused on just the first major acute problem for me. I eventually got, additional support from other places, but I sort of had to seek that out myself. And one of the things that I worried about when I was initially going to see my first therapist was, what did they know about HIV? Do they know I'm not a risk to them, for example? I wasn't even sure if they had any basic training in HIV. And will I have to keep explaining what the impact of the stigma associated with HIV is on my day-to-day life, or will they already know some of that? Some of the subsequent therapy I got was from kind of specialist organisations, and I didn't have to sort of explain everything to them in the same way that I did initially in my first therapy.
Calum, what do you want to see from the government on this particular topic? Quite clearly, the survey has found some pretty big gaps in provision, gaps which we would do well to plug.
A variety of things need to be done. We need better training for existing mental health professionals about HIV and its impact on mental health. We need more culturally competent and diverse services that really reflect the communities that they serve. And we need better connected services so that people living with HIV receive joined-up care and are not left to fall through cracks in the system. And these improvements need to be embedded in the government's HIV action plan, which we are expecting to be published later this year.
Eugene, I just want to give a final word to you. How are you keeping these days?
I'm doing a lot better. I've had a lot of support over the last kind of 3 years. I reached out to the Terrence Higgins Trust and I got specialist counselling for people living with HIV. That really helped. I got into drug and alcohol recovery about 3 years ago. I'm sober these days. Drugs and alcohol were something that I used as a coping mechanism, but things are a lot better now. And one of the things I do now is sort of volunteer with HIV charities. I also work for an HIV charity now part-time, and I tell my story about living with HIV and the impact that that's had on my life. And given that I couldn't even talk to friends about this a few years ago, that's a massive difference for me.
Well done, mate. Good to hear. Eugene Lynch, Calum Douglas, thank you both very much for joining us. Really appreciate it.
Thank you.